I think this is one of the toughest times ever to be a senior leader in the NHS. You know, how on earth do we continue to improve quality, to improve patient safety at a time when costs are so constrained? I think that as leaders we have some real choices about how we rise to the challenge. You know, we can make a choice I think that none of us would want to make, but often we feel compelled to, where, you know, we need to cut services, we need to cut posts, and in a sense patients end up paying the price for the economic situation that we find ourselves in. But, you know, we can make another choice, a different choice, and Energise for Excellence is part of that other choice, which is understanding that we have an incredible workforce, an incredible frontline workforce who have skills, who have knowledge, who have imagination, and that if we could, you know, set free, liberate that energy, that imagination, those skills, then actually those frontline staff can actually solve many of the problems that we have.
It's about a whole concept and a whole framework for both improving quality, improving patient experience and reducing cost. And the key thing, I think, for everybody is that this is everybody's job, it's everybody's business. And while nurses do a lot of that frontline care, they need to work as part of our overall team, whether that be a team of clinicians or a combination of clinicians and managers. And if everybody's working to the same goal, if everybody's committed to the same level of 5 fairly simple actions in order to implement E4E, the outcome will be better in the long run.
We're working with nurses and midwives, and there are a whole range of resources to try and support them in engaging with E4E. And we're doing that through a variety of ways. So each strategic health authority has a regional E4E lead who is there to champion and support their local area and work with local trusts and directors of nursing through existing networks to promote and develop E4E. So that's one way. There are also a series of websites that nurses and midwives can access. There is an Energise for Excellence website on the Department of Health. It's a repository of information around what E4E is. And we're also working with the NHS Institute to develop a call to action website. And that site will be a much more interactive place where nurses can ask each other questions, share good practice, share stories, and really gather momentum around the whole call to action and making this something live and tangible.
For me, one of the best ways that E4E can help organisations meet quality and financial challenges is by reducing the number of avoidable harms that patients may suffer. So as an example, E4E contains lots of tools and techniques to do that. So using things like Safety Express, nursing care indicators can actually help organisations reduce the number of patients that have falls, pressure ulcers or healthcare associated infections.
The reason that Energising for Excellence is so important to us is because our fundamental strategy is quality. We believe that we can get through the financial crisis over the next few years by improving quality, and E4E gives us a framework within which we can do that.
E4E has been really helpful to us within the Tameside and Glossop business group because it has provided us with an infrastructure and framework that provides us with a wonderful opportunity to be able to integrate some of those care pathways.
Some of the initiatives that have come out of E4E, the newest, which is the Patient Safety Cross. The idea of a Patient Safety Cross is it gives a visual indication to anybody who walks onto a ward area, just gives them a snapshot of how safe or not the care on that ward is.
I think that E4E has been excellent in being able to lead and engage staff because it's something that they can actually see, validated information that's demonstrable on paper.
The E4E certainly has embraced everybody. Certainly as ward managers, of course we want all our wards to be the very best. That is natural. There is some healthy competition there, and I laugh and I smile when I say it because it's natural. We all want to make sure we're performing to high standards. The fact that it's on notice boards and it's publicly displayed for managers to come on, my director of nursing to come on, for patients, relatives, for even staff, it's like, there's a certain amount of pride there that we have to embrace and take on board, and it is very important to me as the ward manager that we are performing to an extremely high standard for my own personal pride as well, and also I know that's extremely important to my team members too.
E4E has made quite a big difference in that it raises the profile of quality, improving quality and standards, improving outcomes for patients. It's all about nurses being energised, if you like, to actually take control, to take responsibility and accountability for measuring the performance of what the nursing services are that they're providing. So it raises the profile of quality and it gives it a structure and a framework that we can follow and a process that we can follow to say, this is what we do well, this is where we need to improve.
E4E being introduced here has allowed me to develop new leadership skills. I've developed new skills in relation to improving methodologies. I've been exposed to collaborative working in a way that I wouldn't have had the opportunity to do before without having to go outside of the trust. But because the E4E encourages you to work collaboratively, you get that exposure and can still stay in your own post as well. So I think it's been a fantastic opportunity.
I think what we've seen over perhaps the last few years is that many nurses, perhaps because of the demands placed upon them, have perhaps forgotten why they came into the profession. And I think what Energising for Excellence does, it reminds them of those core values and what they're about and what drew them to nursing in the first place. I think for the organisation itself, clearly we're interested in improving patient safety and quality of care, and that's very important to any organisation.
One of the beauties of almost anything you do that improves quality is that it reduces cost. If somebody falls in hospital, it means that they stay longer in hospital, which costs more. If they get an infection, they stay longer. If they have a pressure ulcer, they stay longer. So all of these initiatives have the beautiful win-win of better for patients and saving money for the system, and staff like them too.
Our plans for the future are to ensure that we get as many nurses and midwives signed up and engaged and committed to doing something about quality and safety improvement. So we've got a goal of getting 200,000 nurses and midwives signed up to the call to action to really make a difference to what's happening out there.
Behind the idea of a call to action is the principle that if we want people to take action, we need to connect with emotions, and the way that we do that is through values. And the most effective way to do that is by telling stories. So tell your own story about yourself as a leader when you've made changes, how you felt, and through your own story, help other people to commit to take action.